It's the top of the hour, so we'll get started. I'd like to welcome everyone to today's GlomCon seminar. I'm Dia Waguespack in Houston, and today we're very excited to have Dr. Jean Ho back, and her talk is titled, I Wasn't Expecting That. When clinical presentation and kidney biopsy disagree with each other, who gets the last word? I'd like to acknowledge the global effort that GlomCon has become, and we thank all of our participants, those behind the scenes. And today we'd like to take a moment to thank one of our corporate sponsors, Travere. Travere Therapeutics is a biopharmaceutical company whose mission is to identify, develop, and deliver life-changing therapies to people living with rare diseases. With the recent approval of sparsentan, a dual endothelin angiotensin receptor antagonist, they've contributed to advancing therapeutic options for adults living with IgA nephropathy. They currently have studies ongoing in glomerular disease, including a phase 3 trial of sparsentan for FSGS. So we're thankful for their support and your support in participating today and in the future. And with that, we'd also like to remind you that the applications for the GlomCon fellowship program are open. We put the link in the chat of where you can go to apply. So we encourage you to check that out. And with that, I will finish and let's get to our talk today and turn it over to you, Dr. Ho.
All right, I'm gonna share my screen. Okay, are we good? All right, great.
Yes, perfect.
All right, so thank you again for inviting me to spend a Sunday morning, a not so sunny Sunday morning here in Beverly Hills with you. The title of my talk, I've been kicking this idea around for a while, and GlomCon was nice enough to let me try it out on you guys. I wasn't expecting that, and really I feel like I should rename this talk, How Life Continues to Surprise Me. This is a series of biopsies where basically the diagnosis wasn't anything what I was expecting based on the clinical history or even the light microscopy. I'm going to show a series of cases. I've got a few. I don't think we're going to get through all of them, but for each one, there's sort of a learning pearl in there. For privacy purposes, I have altered some of the clinical information, but none of the changes really affect the message or the gist of the biopsies. So this is case one. I call this when the biopsy throws a curveball at you. So some of these cases have more extensive clinical histories because they were in-house, others are more limited. I've shown you everything that I was aware of at the time of the biopsy. So this first case is a 35-year-old female with proteinuria. She was previously morbidly obese. She lost over 100 pounds. She had consulted a nephrology during her pregnancy. Because she developed proteinuria, the nephrologist told her at that time that she either had obesity-related glomerulomegaly or unsampled focal segmental glomerulosclerosis, but didn't seem all that concerned. She delivered 4 months ago. She was actually induced for preeclampsia, where her proteinuria was again noted, along with the hypertension. She did gain 60 pounds during her pregnancy, and she also developed gestational hypertension and diabetes. She didn't have any immediate post-operative complications. She doesn't have any swelling. She does complain of some dizziness and nausea. And then following pregnancy, she had persistent proteinuria, so she actually consulted a different nephrologist here at Cedars where she was evaluated. So given that clinical history, she's pregnant. And at this time, I don't actually know when her proteinuria started. All I know is that she did develop proteinuria during pregnancy. There's a series of pathways, algorithms that start in your head when you're given a clinical scenario. When you look at a biopsy, I'm sure all of us do the same thing. It's really to sort of get your mind ready to look for certain things and make sure you don't miss certain things. 9.9 times out of 10, it's great, but that 0.1% where you've sort of put the blinders on and your brain is headed down a certain pathway is where the surprises happen. So common things that occur during pregnancy, I found this table. It's actually a really good one. In her case, because she was morbidly obese at one point, I wondered if she could have secondary FSGS from obesity-related glomerulomegaly. There's always the question of thrombotic microangiopathy in association with preeclampsia. She has gestational diabetes, could she have some diabetic glomerular changes that might be contributing to the proteinuria? And again, I don't have a quantification, so I don't know if it's non-nephrotic or nephrotic range proteinuria, but these are sort of the things that I was thinking about as I went through the biopsy. So let's start with the biopsy. It was a very nice biopsy. There were 3 cores. There were about 50 glomeruli. About 5 or 6 of them were globally sclerotic. And even at this power, you can begin to see that there is some cortical scarring here, these atrophic tubules here. You've got plenty of glomeruli, which we'll look at in closer power. You've got some vessels here. So you've got all 3 compartments. You've got the glomeruli, the tubules, and the vessels, which is great for a complete evaluation. So here is a core showing again some really mild cortical scarring. You've got some atrophic tubules. There's really no significant interstitial.